I'd like to tell you a little bit about what we do here at the clinic, okay? My job here is to make sure you understand why you're here, the fertility control plan we can come up with together, and also prevent your pregnancy scares and risk, okay? I hope everything I said is clear.
Yes.
Okay. So you have a role in this process, okay? Your role in this process is to be as open and honest as possible, okay? Um, I'm not here to judge. I'm not here to criticize you on anything you say or do, okay? I'm only here to help you come up with a preventive plan, come up with a birth control plan for you, okay? Now, anything we say here, any and everything we say here is extremely confidential, will not be discussed with anybody else except two of us, okay? I hope that makes you feel a little safe and, okay, okay. There are 5 goals we'll collectively discuss, okay? One is to come up with a plan, plan that will be safe for your personal life. I said, you particularly, what together, what can we come up with that will be good for you, okay? Now, secondly, we got to come up with one that is acceptable for your level of risk, okay? That, we have to meet your acceptable level of effectiveness, okay? Now, we also got to come up with one that is good for your sexual lifestyle. As much as we want to pay attention to your personal life, we also pay attention to your sexual life, okay? Now, also one that is affordable. We want the best for you, but everything else counts. So, affordability also counts, okay? And one that is culturally appropriate for you. We got to think about what you believe, okay? So, I hope everything is clear.
Yes.
Okay. So tell me a little bit about yourself.
My name is Renee. I'm a 21-year-old college student at William Patterson. I've been having sexual intercourse since the age of 18.
Okay.
I had quite a few partners, but they never lasted long.
Okay.
So now I met this guy 3 months ago, and we've been having sex often. And I'm looking for a different prevention. I'm looking for a different method of birth control other than condoms.
Okay. So, if I'm right, from all your past relationships, you've used condom as the preventive method.
Yes.
Okay, and you don't want to do it anymore.
Right.
Okay. So, do you know anything about birth control?
Well, I know about the termination, which isn't an option for me.
Okay.
The Depo shot, I've heard about that. The side effects that I hear from them, I'm not sure if that's a birth effect that I want to take, The pills, I might forget to take those, so just need something that's more efficient and effective.
Okay. 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 So I'll tell you a little. I'll actually define. Well, you're in the right direction, but I'll just give you what exactly birth control is. Okay. Birth control is a broad term composing of all the methods designed to prevent a pregnancy or birth. Okay. And sometimes even the interruption of a pregnancy. Okay. After conception. So you're right. Just like you said, termination is not an option for you. The shots is also not an option for you. The pills are also not an option for you. But I'd like to tell you all about all 7 of the preventive birth control plans that we have. Okay? Now, one is engaging in non-penetrative behaviors. Okay?
No sex, basically.
No sex, basically. Prevention, they say, is always better than cure. So if that works for you, we'll refer you to a doctor, okay? There's another method that prevents the sperms from reaching the eggs, okay? That's more like on the other side of the partner. That's him, okay? Which is a condom.
A female condom.
Exactly, okay? One that provides a barrier between the sperm and the eggs. I'll give you examples as we go forward, okay? A method that also prevents the implantation of a fertilized egg. So it'll more like it just prevent the eggs from fertilizing anytime there's a sperm around. Okay? The fifth one is also one that will prevent you from prevent your ovaries from releasing eggs. Okay? And the sixth one is also that will prevent the sperms from reaching the eggs. Okay? And the last one, which you said is not an option, which is the termination of an established pregnancy. Now, these are all the 7. I could give them to you to watch, but you'd have to sort of make a decision so we can come up with a plan. Okay?
Okay.
If I may ask, nobody knows about this, right?
No.
Okay.
I had a pregnancy scare this month actually, and that's why I came in here because I don't want my mom to know. I don't want to be pregnant because I want to finish school.
Okay.
So I'm just, weighing out my options on other ways to prevent getting pregnant, but also ways to prevent getting STDs.
Okay. Okay. So there are a few things I can help you, I can suggest to you. Left to you if you do them or not. Okay? Now, the first thing we suggest as counselors is practice the ABC method. Now, this is it. A stands for abstinence. If you can, abstain totally. Okay? Now, the B stands for be faithful. If you can't be abstinent, then be faithful, which you have done in the past 3 months, and I will commend you on that. But C is use a condom if you cannot be faithful. Okay? Now, that's what you're trying to stop doing. Okay? So you'd have to, I would refer you to a doctor, a professional in the field of pregnancy, more like a gynae. Okay? That will help you. Choose based on your fertility rates and other stuff. You come up with stuff. You come up with stuff that is good for you. Okay? So, do you have any other questions for me?
Not really.
Are you leaning towards any of the 7 steps?
I'm looking maybe the implantation,
Yeah, okay.
but then again, it will still need to use a condom because of STDs.
So with STD,
So the birth control will prevent me from being pregnant, but not prevent me from getting
Exactly.
an STD.
so your STDs, I'm going to tell you this. Like I said, practice the ABC rule. Abstain if you can. If you cannot, be faithful to one person. If you cannot be faithful, use a condom.
But what if I'm faithful and the partner's not faithful?
That's why the first one says abstain. And then you come to be faithful. And then use a condom. Because as much as you might be faithful, you don't know what the other party is doing. So just abstain if you can. If you cannot be faithful, use a condom. Okay?
Okay.
I hope you have a few questions for me.
So you won't tell my mom about this, or?
No.
Okay.
Extremely confidential.
Okay.
You're of age, we can do it.
Okay.
You're 21,
Yes.
so you're of age to make decisions on your own. Okay?
All right.
Anything else?
Will you send me like a referral to a doctor,
Yes.
a clinic now?
And I hear you want to go back into law school.
Yes.
Okay.
Yes. That's why I don't want to get pregnant because I
You
want to
don't
finish my school and become a lawyer.
Oh, okay. Nice. Okay, so just like I said, abstain if you can. Be faithful if you cannot be abstinent. And also, use a condom. Okay? But until then, I'd refer you to a gynecologist
Okay.
who will help you with implantation. And he will direct you back to me in the next 3 weeks, okay?
All right. Thank you very
Thank you.
much.
Have a good one. I'll
welcome.
see you later.
All right.
All
sir.
right.
Thank you.
All right, is that 10 minutes?